So this is an example, like I said, from an animal. This is from a monkey. And this is just an example to sort of highlight to you some of the structural changes we can see. It's kind of confusing, I know. But if you look at the tubes that you see along the line, it wasn't always that way. We're seeing increasing levels of this allergic type disease. Food allergies. I mean, I couldn't believe this when I was preparing for this talk, and I went to look for a good picture of a food allergy. I thought, what am I going to take a picture of for food allergy? And there's a company marketing these shirts to babies. Attention, I have food allergies. Please do not feed me without consent from my parents. Thank you. And I thought, oh my God, there's actually enough people out there to buy this sort of thing that, you know, I mean, that just, it's amazing to me. But, and then in the bottom, you can see a child using an inhaler. We see asthma, and asthma is also increasing rates of asthma. So this sort of allergic spectrum disease, it clusters. The same patient will have all three, or two of the three, or in a family, siblings will have two, you know, one will have the skin problem, one will have the asthma. It does cluster. So when you have one, you're at risk for another. And we don't fully understand what's underlying this, but we do know it's probably a combination of genetic risk and environmental risk. And so in Sonoma, why is asthma important in Sonoma? Well, a lot of kids have asthma in Sonoma County. 22% of Sonoma County children aged 5 to 17 have asthma. Average cost of childhood asthma hospitalization in Sonoma County, so if one child is hospitalized, you're looking at $6,000. That's a lot of money. So, and when we consider risk, and we consider risk of asthma, it is important. I really respect the people who do the reports for Bay Area Air Quality Management District, and I think that we have amazing people working for us in our state EPA, in our Office of Environmental Health Hazard Assessments. But what you have to figure out is what you want and are going to do as a community, and that can be very different. So in Petaluma, near this plant, there are 4,560 students attending school within 2 miles of this plant. That's a lot. And so here's a little bit about the particulate matter we keep talking about. The picture up on the right is a picture, the long tube is a hair. So if you imagine that's a hair, it's so dark, I'm sorry, but the one leaning up against the side, it's these little red balls. Those are the PM10s, and the 10 indicates the size. Everything smaller than 10 micrometers is a PM10, okay? PM 2.5s are everything smaller than 2.5 micrometers, and they're sort of illustrated with the little blue balls sitting on top of the little red balls. On the right, the big rock, that's a fine particle of sand. So this kind of gives you a perspective on how small these things are. Like I think somebody already said, the 2.5s, they can get down into the deeper parts of the lung. Everything smaller than 2.5 includes those ultrafine particles that we don't know very much about yet. And those are so small that they can actually make their way, we do know they make their way into cells. I mean, you can pull up a picture on Google of them within a cell. You can see a picture of it. We don't really know what that means for health, but we do know that occurs. And they do make it into blood vessels. The PM10s are bigger particles. They make it into the lungs, but the upper parts of the lungs. And PAHs that keep coming up as well can actually become adhered, because these particulate matters are like a carbon core with a big chemical coating on it. And the chemistry of that, I mean, every particle is different, right? Every emission is different. And so if you look through the medical literature, you're not going to find, particulate matter with X, Y, and Z chemical was studied. You couldn't really come up with a good epidemiologic study of that. So what you'll see is diesel emissions particles is what a lot of the studies have been done with. And what I'm going to present coming has to do primarily with the PM 2.5s. So we know that the DEPs, so the diesel emission particles, are developmental immunotoxicants. They're toxic to the immune system. And the way they're toxic is they prime the immune system to be allergy prone. They're also asthma triggers. We see in children increased use of medication for asthma and increased hospitalizations for asthma correlating directly with how close they live to a freeway, and correlating directly with how close they live to industrial sources. And these are studies that have been done and repeated multiple times throughout California. A lot of them started in Los Angeles, where they have much worse air pollution than we have here, lucky for us. Sorry for you, Dr. Clark, but so a lot of that research came out of Los Angeles initially, and then now we have more recent studies coming out of the Port of Oakland, so much more local. And this is pretty well established that you know, they do these things to children. They're carcinogens as well, and I think for children, I think it's more important right now to talk about the other factors. And I have to admit, I don't see lung cancer. I've never taken care of a single child with lung cancer, so it's beyond my expertise. But diesel exhaust particles induce inflammation in the lung. Okay, they do that through a variety of mechanisms. I wrote up their oxidative stress. It just means that the type of chemicals that they cause get into the lung and cause a reaction by the lung to be inflamed, and that's part of why we get asthma exacerbations. They enhance the response to new allergens. So you have something new, you have an allergy, you actually have more of a response in the presence of the diesel exhaust particles than you would have without it. And they actually cause changes to how our DNA is read. This is the immune system I'm talking about. This is the part I'm discussing. On the left, you have the DNA. Your DNA has to be read to decide how your white blood cells are going to form and how they're going to react. Okay? And you have two main directions that those white blood cells can go, these particular type of white blood cells. These ones are called T helper cells. They can go along a track of T helper cell 1 or T helper cell 2. Okay, T helper cell 1 at the bottom sends you down a path that's going to end up fighting disease. T helper cell 2 sends you down a path that's going to end up with inflammation in the lung and allergy. And so what we're beginning to understand is that diesel emissions particles tip the scale. And now we're trying to figure out why. Why would that happen? Why on earth could a diesel emission particle cause the immune system to decide to be more allergic? And it looks like that's at the level of the DNA. And what they're doing is what we call epigenetic changes. So it's not that they're going in and breaking the DNA and changing it. It's that when the DNA is read, all the DNA is twisted up like that. It's just twisted in this big coil. In order to read that DNA, it has to open up a little bit. And then there's chemicals that come in, read it, and produce proteins, produce cells, out they go and do their job. Well, there's these little ball things. You can kind of see them attached, the yellow and red balls. And those are methyl groups. Okay, and these are little methyl groups define how open that DNA is, how available it is to be read. So if you change those, you change the way the DNA will be read. If those are gone, the DNA closes up tightly. And there's a lot of our DNA that doesn't do anything. It just sits there closed up tightly all the time. If you add some of those, you open it up. So a modification of those has a real potential to change how a developing fetus and child grows when all the programming is going on at the level of the DNA. So we know now that diesel emissions particles impact this methylation. They impact how these methyl groups are on our DNA. And that's what we think is causing this more prone to allergy and asthma effect. So these developmental immunotoxicants are not always assessed under current regulatory standards. They do try to include them in assessments. You know, when we develop models for risk assessment, you know, everything is based on models. We have to make estimates. We have to make good guesses to understand how people are at risk and how their health will be affected. So we do try, but it's not perfect, right? We're not quite there.